Thank you very much for that warm welcome, and it's my pleasure to be here with you all today, both in person and virtually. Today, I'm going to talk about a research project that our team has been working on for quite a long time, since summer, fall 2020, and we're starting to finally get some research fruits of that project that I'm excited to share with you today. So by this time, we're all familiar with this problem of the COVID-19 infodemic, and it has generated a great deal of concern about how the proliferation of online information, whether accurate or inaccurate, might influence the course of the pandemic, the public health burden of the pandemic, social, political, and economic disruptions around the pandemic. The thing is, we still are collecting evidence on really what are the sort of the consequences of this infodemic. And that's what I want to focus on today. You know, this infodemic became a widespread almost in our colloquial and really gained sort of the media and public attention in summer of 2020 with the advent of this very popular conspiracy theory, plandemic, right? That sort of awakened us to this problem, though those of us who have studied misinformation, disinformation for some time, were well concerned about that. And it really has evolved from that time. We've seen cycles of misinformation, the topics of misinformation have evolved as the course of the pandemic has evolved. And it continues to this day. So our sort of central question in this study, and part of this grant that we've been working on since 2020 is, what are the downstream consequences of misinformation? Misinformation, disinformation is important from a public policy perspective, not only for the pandemic, for all policy issues. How do you have effective collective responses to public policy issues, whether it's the pandemic, whether it's the economy, whether it's national security, or other types of topics facing our country or the world, without some type of shared reality between the public and policymakers? Right? That influences even the terms of debate about the public policy. So two questions to this though are not only where do misinformation stem from? And there's a great deal of research that's been looking at this, right? Looking at what the online content is, why people believe misinformation or false or misleading claims, right? There is less research though on what are the downstream consequences for attitudes and behaviors. Partly because there's methodological challenges around it, right? Or the evidence is scanned, it's difficult to measure, to ascertain. And so our question is really sort of indirectly, how does false and misleading information influence the public health burden around the COVID-19 pandemic? And that's sort of the genesis of this grand idea that was funded by the National Science Foundation. And when we talk about public health burden, we're talking about things that contribute to cases, hospitalizations, and deaths. Things like vaccination, trust in public health actors, social distancing behavior or attitudes about social distancing policy, simply wearing face masks, right? We've seen misinformation about all these topics proliferate online, but is there a linkage between people believing these false claims and these attitudes and behaviors, right? To date, there is some evidence, but there are certain weaknesses that this grant was trying to move beyond in ascertaining and measuring those associations. So the data I'm going to present you today is from a rapid grant we received in 2020. Northwestern was the lead in collaboration with former colleagues of mine at The Ohio State University. And really what we try to do is look at this sort of systematically by incorporating three types of data collection to look at this problem. One is social media engagement data, collecting data on what the most widespread claims are, both accurate, inaccurate, how many shares and likes and comments they're getting over a 7-month period, right? Using that social media analytics to incorporate with a longitudinal survey, panel survey that we ran over 7 months, which I'll get into in a minute. And part of this data is we're actually online behavioral tracking. So not only did we survey participants on their attitudes and behavior, we actually, all these participants, we track their online behaviors. We know how often they visit social media platforms. We know what partisan websites versus mainstream websites are going to, what videos are playing in YouTube, right? So by incorporating sort of this holistic data, we can start unpacking this question of the relationship between the infodemic, what's actually driving belief, as well as what the downstream consequences are of this sort of information ecosystem. Today, though, I'm going to focus on two dimensions of this grant, just the social media analytics and the longitudinal survey panel. As you can imagine, real-time behavioral data over a 7-month period for a large population in our survey is a completely complex matter. So we are still sort of analyzing that, and hopefully we'll have some results maybe to share later this spring. But right now I'm going to focus just on the social media analytics part and the longitudinal survey panel. So two sort of methodological challenges when it comes to studying misinformation, all right, or just online claims about X, whether it's COVID or national security, is what are the most important or influential claims, right? If you look at the literature, how do you identify them? How do you actually incorporate these claims, and what claims matter into your study design? One is simply looking at what claims are being fact-checked, either accurate, inaccurate, right? But of course, fact checkers are not doing this necessarily in an objective way. There are certain biases and processes, right? One fact checker might focus on one claim, another fact checker might focus on another claim, right? What are the metrics or decision rules I use to fact check certain claims versus ignore others? You could look at simply instead looking at what's being fact checked, or what is the media talking about, right? What claims, either accurate, inaccurate, are they simply talking about in their TV coverage, in their newspaper coverage? What claims are they trying to debunk? What claims are politicians necessarily putting out there into the space, or even they're highlighting as accurate, inaccurate? Again, bias is subjective, right? A third claim, a third methodology for identifying or using or trying to incorporate claims into your scientific methodology often is simply researcher intuition. Right? As an individual researcher, I think these claims are more influential versus these based upon my own internal decision rules, my own background. I'm a health researcher. I'm going to focus on health claims. I'm a political comm researcher. I'm going to focus on political claims. So sometimes it's simply subjective researcher bias that goes into it. Lastly, in the approach research took is sort of what we consider looking at objective social media metrics, right? We used a commercial platform, I'll go into this in a minute, to instead of looking at only one platform, for example, Twitter, which only 15% of Americans use, or using CrowdTangle with Facebook, which doesn't give you individual posts, but group posts, and there's biases in even what groups are included in CrowdTangle. We decided to use a social media analytics platform called NewsWhip that surveys the entire social media engagement around online news and blogs and gives us objective metrics on how many shares, likes, and comments they have. And using this methodology, which I'll talk about in a minute, we source what claims, either accurate, inaccurate, are actually getting the most social engagement online as an indicator then to use in our longitudinal survey, rather than relying on third parties or researcher intuition. The second methodological challenge, which our study was somewhat designed to address, is how, okay, you identify your claims and what and are getting the most engagement online, but how do you link those claims to downstream consequences, attitudes, and behaviors? One are lab studies. There's lots of lab studies that have high internal validity, right? They have great causal leverage, but what about the external validity of looking at how exposure to misinformation might influence vaccination intent or wearing face masks? A second study, and you see this in the literature, and partly this is a response to what we've seen published thus far around the COVID pandemic, right? A lot of lab studies, are some cross-sectional studies. There's been some good cross-sectional studies, survey studies, looking at the relationship between false or inaccurate beliefs in wearing masks or vaccination intention, right? But a lot of them are cross-sectional. So again, high external validity, low causal leverage, right? Our study is not perfect, but we thought we would try to sort of maximize some strengths and minimize some weaknesses. So that's why we chose a longitudinal panel, right? We have greater causal leverage in a cross-sectional study, but we also have greater external validity than a lab study, right? So again, there are weaknesses to any methodology, but we thought this one would at least give us a greater sense of the evidence when it comes to what are the linkages between beliefs and endorsement of accurate claims over time and downstream consequences. So when it comes to our claims, which is the first part of our study, I talked about how do we identify the claims that we use in our panel study. We're focused on what we call social mediated claims about COVID-19, all right? What are the most widely shared accurate and inaccurate claims about COVID-19 from news and blog domains on Facebook, English language primarily. We didn't look at foreign language. So we looked only at English language, primarily United States, right? So that's another boundary condition that we're looking for. Why this content, right? Social mediated news compared to often news or information that you might consume from other channels or even directly from a website or even your Google feed is often more emotional, more polarized. There's a greater prevalence of less credible sources in social media news, especially the news that gets the most shares, likes, often might be amplified compared to other channels. It has a greater reach than individual posts, right? We're talking the reach of hundreds of thousands or millions, right? Not, all right. And it often has greater perceived credibility. It's not coming from an individual, it's coming from a news source. Even when it's opinion, it's coming from a news source. And the ability for participants to, not even participants, just users to differentiate between opinion and news is weak, right? And lastly, our study, and this is a critique of, for me, a lot of the misinformation research, we focused on banal everyday claims, especially false or inaccurate claims about COVID-19, right? We're not talking about 5G causes COVID-19. We're not talking about chips in, vaccines, right? But we're talking about whether COVID-19 is any more severe than the flu, whether face masks are an effective prevention device, whether social distancing lockdowns work or not, right? These are the credibility of public health actors, right? At the state, local, federal levels, right? So these claims often are, you get higher prevalence. They often have a greater face validity than more outlandish conspiracy claims that a lot of misinformation research focuses on. I understand why, but are they as influential as these claims that people that are not as exciting, but there might be being exposed to on an everyday basis in their social media feeds, right? So that's something that we're interested in. So how do we identify accurate and inaccurate claims? We use NewsWhip as a commercial product, all right? And we basically collected the most engaged 15 to 30,000 stories about the pandemic each month. And what we actually did is we downloaded every day the 5,000 most widely news stories in English, right? And then that basically created a database of about 150,000 stories a month. And we filtered them for COVID-related content. And over the course of our study, we saw variation. I'll show you in a minute. We basically identified what are the most socially engaged stories. And then we literally went story by story in the top most socially engaged stories and fact checked them, right, with our team. We looked at what domain are they coming from? Are they coming from New York Times or LifeSite News, right, which is like a conspiracy domain, right? We looked at other news coverage on the same topic. We looked if there had been any fact checking about it. And we actually had a whole team of grad students and scholars assess the veracity of the claim and basically of the news story or the central claim of the news story. And from that, we basically identified 120 claims that had the most social media engagement, all right, over our 7-month study period to include in our study. This gives you a sense of our data collection when it comes to social media COVID news, right, and articles. As you can see here, right, the peak really was in December 2020, around the winter surge and the news about the authorization of vaccination, which generated a great deal of media attention. And public attention was highest there. And for the most part, you see public attention, which is measured here in hundreds of millions of likes, shares around COVID news each month. And media attention pretty much are in hand until we get to about here in February, right? And there you see that with the advent of vaccination, cases going down, Biden talking about being like COVID-free by July 4th, right? Some of the discourse. Public attention really started to wane, though media attention remained moderate, didn't wane as much. And that's often what you see. The media might be still talking about it, even the public is not as engaged, right? In some ways, from a public policy perspective, it's interesting to see how media attention versus public attention varies over time about some of these issues. So this is a preliminary coding of our claims by topic. And you see some asymmetry here. When it comes to false or misleading claims, the #1 topic was public health trust. 30% of our claims were basically attacking federal, state, local public health actors, scientists, public health experts, right? That was the focus of the false claim, right? Usually in a negative way. A quarter, well, a fifth was vaccination, and then the 19% was political actors, primarily Biden and Congress, right? And then face masks was about the fourth most popular topic of the focus of the claim. Little different for accurate claims, where vaccination was about almost 40%, 2/5 of all claims were related to vaccination, and then the politics of COVID, right? And then lastly, health impact. So when some famous people died, a famous musician, some of the health impacts of COVID on children. So these are some of the other sort of health impacts. And then lastly, social distancing was the fourth most topic. But you can see that, and remember this, because when we get to the results of our modeling in the survey, you'll see a pattern emerge. This also gives you a sense, and part of the reason I'm spending on this is I think it's really important when we talk about misinformation or just media effects or social media, we understand the information environment as well as sort of the psychology and outcomes, because really often the information that those outcomes should be a reflection of what we see in the information environment. What's interesting here is, and this is somewhat reassuring, because sometimes we talk about the moral panic of misinformation. What we found is that false stories with false or misleading claims did have less engagement, right? That accurate stories had almost two-thirds more engagement than inaccurate ones. So it's not like the idea that, oh my gosh, we're being inundated where most engagement is going to false claims, right? We do see more engagement. And you can see even where they have similar topics, the amount of engagement around political trust or political actors for accurate was more than double than inaccurate. The only place where you see a similar amount of engagement is around vaccination, which is interesting, right? The one thing to keep in mind, though, there were more vaccination stories when it came to the accurate than the inaccurate. So actually, on average, the inaccurate vaccination stories are getting more engagement than the accurate ones in some ways. But that's the only topic where you see that difference. Okay, let's talk about the panel. So that's the information environment. Let's talk about the panel design. So it was a YouGov panel, which is a common panel used in political science and communication. We started with 1,200 respondents first surveyed in December 2020. And we ended the survey, it usually did like the first 10 days of each month, ended it in June 2021. So again, when you think about some of the results, we need to be nuanced on the time frame when this is occurring, right? And we had attrition. It was a survey without replacement panel design, but we still ended up with about a little over half completing all 7 waves, right, of the survey over the course. And this is a panel not only where they're doing the self-reports, all these panelists have signed up to have their online behaviors tracked as well. Right, so we tracked that for the entire 8 months, actually, so we started a month early. And what we did is we took the claims from the prior month. So in December, we took the most widely shared accurate and inaccurate claims and asked about it in the beginning of the December survey. So we basically asked about claims that are most widely circulated the prior month. This gives you a sense of what the mean endorsement was for both true and false claims. As you can see, again, this should be somewhat reassuring, is that accurate claims get a significant more endorsement in terms of people saying that they're true. In terms of veracity, probably true, definitely true. They average between 4, 4, 5 over the course of the study, where inaccurate claims have significantly less endorsement as in terms of the veracity. And there's some significant variation over time, as you can see, which we're modeling in our panel. So when it comes to measuring COVID-related attitudes and behaviors, one of the limitations is these are self-reports, all right, which is always a limitation in this regard. But we basically look at 6 different dimensions of COVID-related attitudes and behaviors. One is public health trust, institutional trust in public health actors, trust in scientists, public health experts, state and then federal, local health officials. Frequency of engaging in risky social behaviors. We looked at 5 different social behaviors. For example, going out to a bar or restaurant, how frequently you do that. Wearing face masks, how often you wear a face mask when you leave the home. And again, this is during sort of the height of it in that winter surge in 2020, right? And then, covered to the tail end in late spring. Support for social distancing policies, restricting the hours of restaurants and closing them or closing schools. The perceived safety and efficacy of COVID vaccines measured on 2 different items, tapping that dimension. And then basically COVID-19 vaccine acceptance, which we measured initially in December as intent to get a COVID vaccine, but then moved to combine those who have intended versus actually vaccinated, right, into a combined measure of acceptance. All right, so the methodological statistical approach we took was a fixed effects 2A within modeling. Aisha, who is our postdoctoral scholar with CPP, has been a great help in helping us model this data because it can be complex. And the statistical model fixed effects, the advantage is that the individuals sort of act as their own control. We can take out between subject differences like age and education along the panel. And we've measured these people 7 times, right? So we can track that change over time. In terms of the model, we control for confounders from both unit specific as well as the panel, the month we did the survey, right? The time effect, right? And this provides greater causal leverage when combined with our longitudinal panel data, right? There's, a cross-sectional design. So here are our results, right? We modeled, we put both misinformation and accurate information. That's one thing also I think sometimes gets missed in the misinformation research. When we look at the influence of information, we should model them both. What is the influence of accurate claims? What is the influence of inaccurate claims, right? And so here what we see, the marks in red show significance, where we did see that endorsing misinformation, which was a combined index of 8 different claims. So it was 8 different claims each month that they basically were asked about. And this is an average endorsement across those 8 claims, was associated with lower trust in public health actors across our panel. Accurate information, there was no significant association. Similarly, we saw that misinformation also associated with the likelihood, reported frequency of engaging in risky social behaviors. Again, accurate information had no association. Also, face mask wearing, right? So the more you endorse misinformation, the less frequently you wear a mask when you leave the home, right? Accurate didn't have an impact. Here is interesting in terms of social distancing policy support, supporting social distancing policies in terms of that attitude. We didn't see a relationship with misinformation endorsement. We did with accurate information. So endorsing accurate claims about the pandemic over the course of the time period, you're more likely to support things like closing schools or restricting restaurants or bars. When it came to the safety and efficacy of vaccination, we also saw misinformation endorsement being significant, accurate information or not. But interesting overall, in terms of COVID vaccine acceptance, we did not see a relationship. Whether it's mediated through perceived safety and efficacy is a possibility. That's something we need to unpack more, but we didn't see a direct relationship. I will also say, though, that most of the claims, the false claims about vaccination that were in the study were about safety, right? Less about, and so it might be sort of the indirect, but it did have a significant relationship. So our conclusion from this, from looking at the information environment and then sort of modeling that with our longitudinal panel data, right, is that misinformation endorsement is associated with harms that might increase the public health burden of the COVID pandemic, right? Trust in public health actors, which is a critical component of public health communication and public policy. Wearing face masks, which increases your risk of exposure, all right? Vaccination itself, at least in terms of the perceived efficacy and safety of vaccination, and the likelihood of engaging in more risky social behaviors. All these combined, we don't have a direct link, but have the potential to substantially increase the burden in terms of cases, deaths, and hospitalization over the course of the pandemic. Right? In contrast, what's interesting to us, accurate beliefs or endorsement of accurate claims had little consequence, all right, except in the case of greater support for social distancing policy. Right? So from a public policy, this being a public policy institute, and it's something we're interested in at our center as well, especially when it comes to information policy, well, what do we do about this problem? All right, we see there's some evidence here of downstream consequences of misinformation. Often the public policy discourse is about regulating algorithmic amplification of false or misleading information or less credible domains, right? Maybe creating more transparency, right, into how these algorithms work, deplatforming less incredible sources, right? And this is the debate. And there is, I would say, a great moral and public policy panic about this, right? And it's bipartisan on both sides in some regard, right? Some thoughts on this is that when you look at the source credibility of where the false claims came from, right? And we use mediabiasfactcheck.com for this rating, right? Which is often used in the literature, along with something like NewsGuard, for example. If you look at the source, about half come from what considered right-leaning sources. Fox News, for example, was in here, or some other considered mainstream news. Only now, at the same time, about then 10%, so half come from right, 10% come from center left, mainstream sources, even I'll talk about in a minute. So about 60% come from either maybe partisan, but mainstream partisan, or even, sources. So how do you deplatform that? How do you regulate these claims, right? That's a challenge. At the same time, you can say, well, there is a bit of a problem when 36%, 37% of our claims that are in the study do come from questionable or conspiracy domains. So, the question is, where's the right balance? All right. And that's why this is an incredibly more complex question that I think is often presented both in the policy discourse as well as the media when it comes to false and misleading information. And again, remember, accurate news stories did have 2/3 more engagement. So it's another thing to take into account. So how much is this algorithmic amplification versus selective exposure, right? There is some research. There's a paper in Information Communication Society published, I think last year, that tried to model how much algorithmic amplification actually drive exposure of some of these claims, and it was limited. And some other research suggests that. So sometimes it might be over our panic. In my perspective, sometimes we focus on social media as a problem, where there are other underlying social, economic, political drivers of this infodemic, that social media might amplify the problem in some ways. It might be reflective of the problem, but it's not necessarily the problem itself. And the loci of our policy discourse is misplaced, right? Not that social media couldn't do a better job especially in terms of transparency of the algorithms, creating tools so researchers and others can see what is going on in there, right? I think there could be more movement on that. And Facebook has actually gone the wrong direction in that in some regards recently, especially with access to CrowdTangle, one of the sole tools to do that. But this is part of, I think we need to realize that this conversation is much more complex, partly because of this finding. So when we labeled something false or misleading, our measure was it a false or misleading headline, or if you read the article, because most people often just read the headline on social media or like the lead paragraph, or when you read it, you would come away most likely with a false or misleading impression. And so the number one false or misleading claim in our study over that summer period came from our hometown Chicago Tribune, right? 4.7 million social interactions, all right? With this article, a healthy doctor died 2 weeks, right? And if you read the article, read the headline, your impression was that there is a linkage or evidence that COVID vaccine killed this healthy doctor. You had a similar article from the Orange County Register, right? Healthcare worker died. There was one from Utah. We found a lot of our false vaccination claims were from local media, especially early on, talking about so-and-so dies, Utah mother, healthy mother, 4 days after vaccine, dead, right? And so this is more bad journalism, right? It can also be co-opted by anti-vax groups. There's research shows that increasingly anti-vax Facebook groups would simply share headlines like this, and to promote they're not sharing fake news or conspiracy theories. They're showing actual real headlines that sort of provide in their minds evidence. And when you see headlines like this and you read it as objective as we did, you can easily come up with that misleading claim. See, Newsweek itself publishing findings from a discredited study, right? Again, it's bad science and health journalism in some ways, right? Or clickbait. The other thing is, as I go back to what are the sources of these claims, many of the articles sourcing these claims were simply quotes or messaging from political leaders. So all these politicians showed up in our study as sources of false or misleading claims about COVID-19. And I don't know why. I think maybe it's the Google algorithm. When you search for their names, you all get pictures of them with their hands up. I think I talk about algorithmic amplification. So, but they all had claims about ivermectin, Rand Paul about lockdowns and face masks, DeSantis about vaccination, Jim Jordan about lockdown. So these are actually the sources of a lot of our claims. And so when you look at right-wing media or partisan media, they're just simply reflecting partisan discourse. So how do you deal with that from a social media regulation perspective? That's my point. Maybe we have more underlying drivers of this infodemic that we need to deal with from a social, political, economic perspective. There are, of course, some limitations in our study. We focused on a specific subset of social media content over a specific time period, right? So there are some boundary conditions and nuance there. Claims may vary across, type, like ours was before ivermectin hit that summer and fall, before Delta, before Omicron, right? So our study, looked at a particular snapshot, and it was a long snapshot, but, the type of claims you see, the targeted claims may evolve. We didn't look at videos. We didn't look at individual posts. I think looking at more cross-platform content is needed in this space in terms of research, right? Looking at video content, which is tough, right? In terms of computationally or coding is also needed. Again, we cannot rule out alternative explanations in terms of our findings, though we do believe we have some greater causal leverage than some of the other evidence presented today, and also greater external validity. And one of the weaknesses, of course, is rely on self-reports. In the context of the internal validity of our study, we think they're pretty solid, but it would be nice to have more behavioral measures. And that's something we're trying to look at and think about. Can we even use our survey data or some of our collected articles and look at other behavioral data to model it with, right? That's a direction we're taking a look at. So moving forward from a pure research, we could probably generate 50 papers from the study, from the data we've collected. But what we're prioritizing is this behavioral data. And we really want to look at, rather than rely on self-reports of social media use or partisan news use, right? We're going to look at the behavioral data to see over the course of the period. We have 8 months of behavioral data for our participants. It's incredibly dense, looking at how it might drive exposure and endorsement to these claims, as well as its direct relationship with downstream consequences. The other thing is that we have a second study with some of the same collaborators of this study that we ran around the election, that also collected the same exact methodology, social media analytics, longitudinal panel study, behavioral data. And so what we want to do is start thinking about this, are there generalizability across contexts? That spans both COVID and elections, for example, that we can take a look at. Are there some similarities they're not necessarily contextually specific? And then working with Aisha in our center, we have now scraped over 600,000 full text news stories from the pandemic and social media, as well as corresponding social engagement data, likes, shares, comments, for example, from a 2-year period. And so having that data and to be able to computationally model it, determine what content attributes of social mediated news, right, in terms of polarizing language, the sentiment, the topics, the level of uncertainty described in it, right? How is that associated using time series analysis, for example, with the UMD survey data, looking over time of Facebook users around COVID, behavioral indicators in terms of Google mobility or other, vaccination rates, pandemic outcome data. We want to sort of try to model how this information space more broadly across a wider range of data sets. And really, it's look at what content attributes of social media news, whether it's accuracy, sentiment, uncertainty, trust, polarizing language. How is that associated in terms of sort of the downstream consequences? And with that, I will simply say that any great research, just like raising a child, takes a village. So I want to thank my collaborators at Ohio State University and here at Northwestern, my co-PIs on this grant. We have the standard disclaimer funded by the National Science Foundation, but does not reflect them. And I'm happy to take any questions that you may have.